This is a heart, and this soft blue bubble around it is its bag, called the pericardium. The heart beats inside the bag. Watch what happens. Right now, the bag is loose and nearly empty. Between each beat, the heart relaxes, and its chambers open up wide to fill with blood. Watch them swell, then squeeze the blood out. That is a healthy, full-sized beat. Now fluid starts leaking into the bag. It could be blood from an injury or watery fluid from infection. Watch the pale fluid pool in the space between the heart and its bag. This is cardiac tamponade beginning. The bag can only stretch so far. As more fluid piles in, the pressure inside the bag climbs, and that pressure presses on the heart from every side, like a hand slowly closing around it. Watch the pressure bar on the right rise. Here is the key problem. Because the squeeze comes from outside, the chambers can no longer open up between beats. If they cannot fill with blood, they cannot pump much out. Watch the beats get smaller and more cramped. There is a second twist when you breathe in. Breathing in pulls extra blood into the right side of the heart. With no room to grow outward, the right side pushes the middle wall, the septum, over into the left side. Watch the yellow wall bow across. So the two sides of the heart now fight over the same tiny space. When one fills, it steals room from the other. Doctors call this ventricular interdependence. Every breath makes the left side even smaller, which is why the pulse fades in and out. Add it all up, and the amount of blood leaving the heart keeps dropping. Watch the green output bar fall while the pressure bar stays sky high. The heart is still beating fast, but each beat moves almost nothing. This is full cardiac tamponade. The bag is packed with fluid, the pressure is dangerously high, and the tiny cramped beats are barely feeding the body. Without help, blood pressure crashes. It is a true emergency. The treatment is simple in idea. Drain the fluid out of the bag with a needle. Watch the fluid leave, the pressure fall, and the chambers spring open again, filling and pumping like before. Relieve the squeeze, and the heart recovers. That is cardiac tamponade. Fluid trapped in the sac around the heart squeezes it from outside, so the chambers can't fill and the heart can't pump, and draining that fluid lets it beat freely again.